Start with the training program. Think of what we're working with. If we have a highly stable body in a highly stable scenario, will it be a challenge for the individual? Not really. If we have somebody that doesn't have a lot of stability in a highly stable scenario, it'll still be a challenge for them. So we want to be able to assess what they're going through and then be able to pick it apart and say, stability problem, severe stability problem, let's put them in the most stable position possible. Stability problem, kind of minor, nothing really major. We can maybe advance them to like a half kneeling or something like that. So we're going to look at things as saying, does it create pain? Does it prevent with obvious dysfunction? Is there really gross asymmetry with it? Or does something just not add up right? And they say that something is working really hard that shouldn't be working. If we look at all that kind of stuff, we'll be able to see if it's high level or low level instability. If everything's adding up wrong, low level, low level, low level. Start them at very basic stuff. Okay? Can I borrow you on this one? So we already used her for part of the assessment, so we'll see if she's improved during all this. So feet together, toe touch. Still has mobility for days coming from her hips. Okay?
That didn't change.
Shouldn't change, right? If we're doing this, we shouldn't be getting worse. That's the key. Feet together, full reach back. Yeah, not bad, but you're not really getting much extension out of her hips. She was getting all lumbar and thoracic extension. Turn sideways. Do that again. Feet together.
I did use my graph.
Is she getting past neutral with her hips? She's barely getting to neutral with her hips. So she's getting all of her extension up here. She's got a lot of it, a lot of extension, but her hips may be restricted through that extension moment. Do you get a lot of hip flexor tightness?
Oh, yeah.
Oh, yeah. Okay.
Oh, yeah.
Something going on in there, all right? It ain't pretty, but it's working. Show me a push-up. Bring your hands right underneath your shoulders. Right underneath your shoulders. Good. No, I just want to see a restricted push-up. Right down into it, and right back up. Good. The transition between down and up, she stayed strong through her hips. Flip over, we're going to do a glute bridge. Push the hips up. Now, I want you to do that again, but I don't want you to roll up. I want you to lever up off of here. So get this solid, and then come up out of it. Yeah, you can come up out of your glutes. I just don't want to see you do a spinal flexion to get there. Come higher out of it. Right there. Now let's check to see left and right side. Bring your feet together a little bit more. Okay. Hips high. Good. Bring your hands up onto your stomach. So we're removing a point of balance. Straighten this leg out. And I want to see if her hips stay stable or if they drop. This one dropped a little bit. Bring that leg down. Get up. Get back to neutral. Get up.
Hamstring pull.
Oh. So what's that telling us? What was working that shouldn't have been working? Okay. Her hammy was going crazy. Okay. From here, tilt just a bit. Right there. Lock it in. Good. This leg stationary. This leg goes up.
The left leg goes up again?
Yeah, I want to see it again.
Really think about it. Hamstring.
Okay, and back in. So she's not able to get the glute to stabilize on that one side with body weight. Maybe an issue, maybe it's not an issue. This leg goes out, but get your hip up to extension. Right there, good. That's better. So we have an imbalance.
Hamstring.
And we definitely have an imbalance, okay? So she can stabilize on this hip way better than she can stabilize on this hip. Something's pointing, right? As soon as we see imbalance or asymmetry, something's pointing to something. So then we have to start looking at it, okay? She had all the range of motion for days to get down there, but she didn't have the strength to drive up. She didn't have the strength to get through extension. Ding, ding, ding. We got two things pointing at the same thing, hip extension strength and stability. Okay, so now we can keep working on it. She's got the push-up strength to be able to get through it. Let's start looking at more things. Come on up. She needs to have glute extension strength to be able to drop into and come back out of a squat, correct? Glutes are a prime mover. Narrow stance. Squat. Come back up. Now go down as far as I tell you to. Right there. At that point, that's where her lumbar spine starts to curve under. So that's her limitation for hip range of motion. We already know she can touch her toes and go right down to the floor. So she's got maybe half range of motion actively as she did passively. Now we could go through even more of an in-depth assessment. Come up onto your back. Let's see what her hips can actually do. Okay, bring this leg straight. Just a very passive range of motion assessment. Relax, relax, go limp. Don't worry, I may not look like much Mount Maury. I can move your legs around. Your legs are about the size of my forearm, but that's all right. So at that point, she's starting to lift the opposite leg. All that means she may be limited through hip flexion. I'm not too worried about specific angles or anything like that because I don't care. You feel pinching in the front?
No, it's just absolutely locked. I felt right there.
It's not moving though.
No.
No, it is.
Okay.
Better. But where does she say that she feels it? In the opposite hip. So maybe this hip flexor is compensating for something over there. It's not dysfunctional, but it's compensating. Something's going wrong. We got to put our Sherlock Holmes hats on here. External? Awesome. She can get to 90. Maybe at 10 degrees. She should be around 45 degrees. We should be able to get way more range of motion on that. So if we go internal range of motion, what's getting tensioned when we do that range? What part? Anything that would cause external range of motion. So we're stretching it. So think of it this way. If I stretch my bicep, I'm stretching everything that would cause elbow flexion, right? So if I go internal rotation like this, I'm stretching everything that would cause external rotation. Don't worry about the one muscle or the two muscle because, hey, it might be capsular, it might be neural, it might be vascular, anything like that. She's limited. That's all I care about. Internal rotation is limited on this hip. She's also really kicking up on the hip flexor on that side whenever she does stability work. This side, boom, she can get there. And she's better, right? So she may have some stability issues on this hip. We already know that. Bring this hand up over your head. Bring this hand up over your head. Okay. What this does by bringing the arms up over the head is stretches out the lats and puts her into a mild extension through her spine. So what that does is get her slightly into an extension. Hold the leg right there. Let's check her strength. Resist. Good, but she compensates. She rotates. Do you see that? So when I had her going straight up and down like this, the second that I put load on, she rotated her hips to provide stability into the mat to find stability that might not be in that hip. She also used her adductors instead of her hip flexor. The second she rotated like that, boom, big adductors kicked up. That could also be one of the things that's resisting internal rotation, okay? Let's check to see if this side is the same. Here, hold it there, resist. Not bad, not bad. So we got a whole bunch of stuff pointing at this hip and the core associated with it being unstable. So she can do the range of motion that doesn't perturbate her hip or her lower back at all, but as soon as we start getting her into a situation where there's something pulling on her lower back or something causing the hip to be limited, or we get her into a weight-loaded situation, something's going on. So let's get her into a side plank, this side down. This side down. That's your good side, I don't worry about that one. Okay, side plank, up on your elbow. Okay.
Two legs?
Nope, not yet. I want you to just get set like you're getting ready for it, okay? So bring this elbow a little bit further underneath, okay? Now bring the shoulder down, tight to your ribs. Good, she's in as close to neutral spine as we need right now. I'm gonna help her out. I'm gonna get you to put that arm right there. Bend your knees. We'll start slow. If she can do it here, cool. I'll get her to do it more advanced. If she can't get it here, she can't go any further. From there, I want you to get into neutral spine, okay? Tilt your hips forward. Right there, good. A little bit further even, right there, good. Shoulders down and tight, good. Take a deep breath, lift up. But don't find stability here, good. So now she has to work stabilizers on her lateral core, stabilizers on her lateral hip. Everything has to maintain, she has to breathe. Bring this down. No, this right here. There, right like that, good. Lift up, and I want to keep her in neutral. Tilt, right there, good. She's gonna find every way that she can to compensate out of it, okay? Back down, relax, take a breath, and then back up into it. So I want her to succeed. If she's not succeeding, she's working way too hard. Okay, belly button in just a bit. Good, shoulder down, good. Right, tilt, right there. Yes, hold it right like that. Okay, now if she's able to do this, great, let's extend one leg. It's hard to see all the angles all the time, so I want to make sure that she's able to get as close to neutral as possible, and if she's cheating away from it, which she is, a little bit, right like that, bring this elbow underneath you a little bit further. Good. Bring your ribs down towards the floor. Bring your rib right down, like think you right there, perfect, lock it up, good. Okay. So sometimes you have to use different cues with them. For her, I'm not going to be able to grab onto her the way I would a guy and just be able to move her around because bits are in the way. Stuff happens. Hold, and then drop right back down. Now I want you to find that spot again. Go right back into it. Okay, lift up just a bit. Right there, good. Shoulder back, now breathe. Okay, now let's perturb her. Let's get her ticked off. Hold, stabilize. So have I stretched her? Have I done anything to lengthen a muscle? Technically, no. Come back down, lay on your back. If she was compensating for an instability in that lateral core by tightening up her hip, by strengthening that area, should she see an immediate improvement in her hip range of motion? Let's check it out. I don't know if this will work or not.
Oh, wow.
Was it a hip rotational issue? It's core. So as soon as we gave her the foundation, she was able to move. Slingshot. This was the handle. This was the elastic. The second we gave her a strong, stable handle, she could pull that elastic back all day long. You guys have just been witness to a magic trick? Yeah?